you please take your seats, I'd appreciate it. Well, welcome to the 2018 Hunger and Health Summit. For those of you that know David Lee, you know that I'm not him. Unfortunately, David got a phone call last night and had to return back to Milwaukee. I know he'd appreciate your thoughts, and he sends his hopes that we have a great conference. My name is Dan Stein. I'm President and CEO of Second Harvest Food Bank of Southern Wisconsin. We're based in Madison. We cover 16 counties, southwest Wisconsin. At the last year, when we met in Wisconsin Rapids, many of the threats that we discussed have materialized to pass legislation and other harmful proposals. And while it's important to engage and advocate for and against the policies that are being proposed, it is more important to remember what these policies and proposals do. They affect our families, they affect our neighbors, and they affect our friends. They affect them from having the opportunity to have the nutrition and health care that they need to build strong local communities in our state. And this is why the theme of today's conference is breaking through. You see, we need to continue to convene and learn from each other, to strategize and implement proven solutions that enable people and families we serve to have the resources they need to build local communities. So we have a real exciting, strong conference planned for you today and tomorrow. It's our hope that the connections you make and the educational content that's provided by nearly 70 local, state, and national leaders will help you break through in your work fighting hunger, improving health, and strengthening our communities. Before we get to where I get to introduce our keynote speaker, though, I'd like to have Ellen Sexton come forward. Ellen is the CEO of Wisconsin Health Plan for United Healthcare, and Ellen's group is our key sponsor. So she'd like to say a few words. Would you welcome Ellen, please?
Greetings. It's so great to be here on this fine February day. I mean, April, right? So as Dan said, I am CEO for United Healthcare Community Plan of Wisconsin. And what that means is we serve over 170,000 beneficiaries across the state. I have several members of my team here. They're a great team. And what I'll say is we have the same mission as many of you, right? And it's about helping people live healthier lives. And food is such an essential piece of that. So when people are surprised about why we would sponsor an event like this, for us it just makes sense. And we're so happy to be here. And first off, I'd like to thank all of you actually in the room for the work you do every day in our community, for how you're thinking about doing things differently. Because one of the first things I learned with our members and when thinking about food insecurity isn't that there's not enough food to go around, it's the distribution and how do we get it to people. And so as we think about our members, I will tell you one of the first things we ask as a case manager is, have you eaten today? Do you need food? So the connection is there between food and health, absolutely. You'll see coming up, United Healthcare will continue to partner in many ways with Feeding America, with organizations. And so what I ask you is think about how you might want to partner with us differently and think differently. One of the things that we're doing as part of a readmission pilot is somebody that has an inpatient stay, we have a case manager, and if they agree to one meeting within while they're still in inpatient and one meeting while they're discharged, we give them 7 meals delivered to their home, right? Because some of the most essential time is when you've just been discharged from the hospital and you're trying to get yourself back on your feet. So think about things differently, if you will. You'll see coming up, we're going to do a major sponsorship around refrigeration with food pantries. We know that's a key area, and so we're looking for different ways to help the community, and I'd ask all of you to think about, as you do your breakouts, as you talk, what are things, what are intersections we could help with. So We have been the proud sponsor of Dinners on Us, and over the last 5 years, what that means is we have served over 455,000 dinners. Now, when I think about that number, I don't think kind of actually how great that number is. I think about how big a need we have and how do we serve that best. So I want to say thank you because first of all, they juggled the schedule around a little bit for me to be able to greet you. And I really thought it was important that I did because it's not just about today, it's about what we also do going forward together, all of us. So thank you so much. I hope you guys have a great conference. And like I said, think about how we can partner with you in new and different ways because we're happy to do that and we need to.
I finally follow someone who's shorter than I am. So David asked if I would introduce our keynote talk today. First of all, thank you very much, Ellen, for not only the sponsorship, but for your great words. But before I begin with the introduction, he also asked if I'd say a few words of how Second Harvest is working at the intersection of health and hunger. Health and hunger are intimately connected. And food banks like ours are working to be good partners in fighting hunger and improving health. A few years ago, we helped to convene the Hunger Care Coalition, which brought together a wide range of stakeholders. And this group has been working with healthcare providers and systems to implement the two-question food insecurity screen in the clinic workflow, and to provide referrals and resources for the patients who screen positive. In addition, we've also worked on pilots in 3 counties where we provide 30 pounds of healthy, nutritious food monthly, consisting of whole grains, lean proteins, and fresh produce, along with recipes and diabetes education to food insecure type 2 diabetics. Our goal is to see if there's any impact over time to changes in lifestyle and health, and to see if food can be medicine. But as we go back to that two-question screen, if the patient screens positive, one of the key resources that they get is being connected to FoodShare. As many of you know, FoodShare provides income-eligible families benefits with money for food to live a healthier life. FoodShare is not a substitute for a job. It is how low-wage earners avoid hunger. And recognizing the importance of FoodShare to the food security of families that we serve, we have invested in creating and maintaining a FoodShare outreach program where local outreach specialists are in communities throughout our 16 counties every day, helping people with information and application assistance. Last year, our outreach workers provided the equivalent of just about 1.8 million meals to people who qualify. And we're in our 9th year of providing these outreach services, and we've reached tens of thousands of people who have relied on FoodShare many times to escape poverty. These clients and these meals complement and supplement the food that's available through the Emergency Food Network, not only through the 16 counties we serve, but throughout the state. So with the upcoming Farm Bill and other proposed changes to important nutrition assistance programs like FoodShare, understanding the administration's views on program flexibility and the USDA's vision for the future will be vital to our success in working towards a healthy and hunger-free Wisconsin. And to better help us understand some of these issues, I'm pleased to welcome Tim English, Regional Administrator for the USDA's Food and Nutrition Service Midwest Regional Office, based in Chicago, and he's here to speak with us today. And under Tim's leadership, the Midwest Regional Office provides oversight of program operations and technical assistance to state and local partners who administer the agency's 15 nutrition assistance programs. He oversees the administration of these federal nutrition assistance programs with nutritional benefits and services that are valued at $15 billion. And he does it in the Midwest region, which consists of Illinois, Indiana, Michigan and Minnesota, Ohio, and of course Wisconsin. Prior to his appointment as regional administrator, he served as the deputy regional administrator for 2.5 years. And for the 7+ years prior to that, as FNS's Midwest Regional Supplemental Nutrition Assistance Program Director, overseeing all SNAP operations in the Midwest region. He's a graduate of Northern Illinois University in DeKalb, Illinois. He's also a graduate of the American University School of Public Affairs, Key Executive Leadership Certificate Program, based in Washington, D.C. After his address, there'll be time for questions. Please feel free to ask them at will. But would you please join me in welcoming Tim English to the podium?
Thank you very much, Dan, for that introduction, and thank you all for being here. And certainly thank you to Feeding Wisconsin for providing me the opportunity to speak with you this afternoon. I think that we can all agree that there are very few needs in life that are more fundamental than access to food. And USDA is committed to improving the long-term well-being of those that we serve through our 15 nutrition assistance programs. As I think you all know, USDA's nutrition programs help increase food security by providing low-income households access to food, a healthful diet, and nutrition education. Good nutrition is critically important at all stages of life, whether it's WIC, Child and Adult Care Feeding Program, or school meal programs providing the nation's youth with a solid nutritional foundation, or the TFAP program stepping in when a family crisis occurs, or the Senior Farmers Market program helping seniors stay healthy as they age, or certainly SNAP supporting folks of all ages in need of access to healthy foods and nutrition education. USDA programs provide participants access to the nutrition support that they need. And because of the reach of our programs and as national programs, federal nutrition programs are powerful tools that fight hunger and obesity. Many of us are at this conference because we see hunger as a critical health issue. Hunger has far-reaching health effects on Americans of all ages. When children are hungry, they're more likely to experience physical and mental health issues, as well as academic and or behavioral problems at school that keeps them from achieving their highest potential. And when adults are hungry and in poor health, they may find it more difficult to find and keep a job. And hungry seniors are more likely to be depressed and struggle to complete day-to-day tasks and retain their independence. Many of you here in the room are leveraging FNS programs to help address the root causes of health challenges in your communities, and we sincerely appreciate your support. The healthcare sector and healthcare organizations like United Healthcare are finding innovative ways to reduce hunger and improve nutrition and health by providing a couple of examples: directly operating or supporting the administration of FNS programs, helping to increase access to locally grown healthy foods in low-income areas by supporting farmers markets and healthy food store options, getting involved in supporting SNAP nutrition education and SNAP employment and training efforts, as well as SNAP outreach, as Dan mentioned, supporting SNAP healthy purchasing incentive programs, supporting the issuance of food prescriptions for persons with food insecurity, and finally, but not all-inclusively, supporting school nutrition and wellness programs. Not only does access to nutritious food support overall good health, a recent study conducted in Massachusetts suggests that making regular deliveries of meals to people who are deemed food insecure drove down their use of costly medical services, such as emergency room visits, ambulance calls, and in some cases, hospital admissions. So I want to provide a great example of how Wisconsin Health Partner is leveraging FNS programs. The University of Wisconsin Hospitals and Clinics, part of the UW Health System, became the first healthcare organization in Dane County to introduce screening for food insecurity for patients of all ages across the healthcare system. They also became a USDA summer meals provider in 2017 and ran a meal site at the UW Hospital and American Family Children Hospital. Their target audience is child outpatients, siblings of inpatients, outpatients at the American Family Children Hospital, and children of adult patients at University Hospital. They started with serving meals in dining areas at the American Family Children's Hospital Monday through Friday, which is normally how the summer meals program works. But because the University Hospital kitchen is open every day, they changed to offering meals 7 days a week. By doing so, they were able to reach children in need by providing meals every day and filling a food gap that these children were experiencing over the weekend. As a result of their work, kids are in better health and better prepared to learn when school begins each fall. The success of USDA nutrition programs is due to partners like you. State and local agencies, health organizations, food banks, and many others who make it all possible. Our nutrition assistance programs work best when federal, state, and local partners work together. We at USDA are committed to flexibility and opportunities for innovation combined with accountability for good management. For those of you who are already leveraging our programs, thank you for getting involved and working with us to address hunger and well-being. So today, the first part of my talk is really kind of preaching to the choir, setting the context for the rest of the discussion. I know that a lot of you are already involved with working with our programs, and as I said, we sincerely appreciate that and rely upon that. But today I want to talk a little bit about our programs in the context of the focus areas of this administration. Our three themes are integrity, customer service, and self-sufficiency. Integrity has always been a focus for USDA in all of our programs, but we are redoubling our efforts to improve accountability, transparency, and reduce waste, fraud, and abuse. We're thinking about customer service very broadly in all of our programs. Certainly with respect to the service that's provided to the beneficiaries of our program, but we're also thinking about customer service with respect to state and local organizations that administer our programs. We're striving to ensure access to our programs for those who most need them, and that our partners who deliver services have the tools and the flexibility to extend those services efficiently and effectively. And finally, with regard to self-sufficiency, we're striving to improve the long-term well-being of those that we serve through our programs. So I'll expand a little bit more on each of these three areas, starting with integrity. Integrity is essential to meeting the mission of FNS programs now and into the future. We're going to continue to improve operations and outcomes in close collaboration with our state and local partners to combat waste, fraud, and abuse, and to best serve our participants and the American taxpayers. Taxpayers support assisting their neighbors in times of need, but they do expect us to get the maximum return on our nutrition assistance investment. As part of USDA Secretary Perdue's strategic goal of ensuring that our programs are delivered efficiently, effectively, and with integrity, 2 weeks ago he announced that USDA will include a renewed attention on transparency, payment accuracy, fraud and waste prevention, and improved quality control. And with that announcement, FNS Administrator Brandon Lips announced the creation of a new position within the Food and Nutrition Service that will report directly to the administrator, and that is the Chief Integrity Officer. And that position will manage the oversight, program improvements, and our overall integrity strategy. The position will be tasked with overseeing integrity initiatives in all 15 federal nutrition programs. With almost 30 million children that eat school meals each day, we're committed to improving school meal operations, and ensuring children receive the nutritious food they need. We're working with our state and local partners to use training, tools, and technology to ensure that programs root out errors and inefficiencies. To support states' efforts to improve program integrity, we've rolled out a suite of customizable resources to help local school districts improve the accuracy of their school meal application processes. These resources include support for online applications, evidence-based materials, and best practices to simplify the process for families to ensure that eligible children receive the free and reduced price meals that they need. With input from local food service professionals, we've developed an online school meal application The customer-friendly design of the application is intended to increase the integrity of the application process by reducing the common mistakes that families often make when applying for free or reduced price school meals. These tools are the benchmark for future innovation and give schools 21st century resources and strategies to run efficient school food service operations now and into the future. USDA has made great strides over the years in increasing the variety of nutrition and nutritional quality of the foods offered to better meet the needs of school districts across the country. Buy American is the guiding principle of school meal programs, and USDA foods, commonly called commodities, inherently support this requirement. USDA foods are required to be 100% American grown and produced. USDA foods support American agriculture and industry while enhancing school meals by providing the nutritious foods that kids need, including a variety of fresh, frozen, canned, and dried fruits and vegetables, whole grain and whole grain rich options, proteins including lean meats, poultry, fish, legumes, and dairy. USDA is very grateful for our partners in Wisconsin, the vendors and the farmers who are committed to providing quality grown products to help feed school children. Wisconsin has been awarded 12 farm-to-school grants from fiscal year 13 to 17. These grants represent a combination of tribes, state agencies, nonprofits, and school districts. Nearly $1 million in USDA farm-to-school grants have been awarded in Wisconsin, ranking it number 3 of all states in the country in terms of the total amount of dollars distributed during that time period. So I want to give a shout out to Feeding America as the national organization that supports farm-to-school nationwide, but certainly also Feeding Wisconsin for supporting farm-to-school right here in Wisconsin. I also want to mention the innovative way that the FarmLink Food Hub is working with schools, hospitals, and other buyers of local food and connecting them with some of the best local farmers in Wisconsin. This is another example, great example of integrity and partnership. So the second focus area for us is customer service. And again, we're committed to ensuring access to our programs, ensuring that our partners are able to deliver services and have the tools and flexibility that they need to administer the programs effectively. We want to empower program administrators with options over mandates and flexibility over a one-size-fits-all approach. Success is not about achieving government compliance, but rather it's about getting benefits and services to people that need them in ways that minimize the burden for those individuals and program administrators. And we must allow our partners to serve customers in ways that are fair and equitable and services, but also make sense in light of local circumstances and needs. And we have a big focus in USDA on rural areas, and we recognize that rural areas have very unique needs and providing the flexibilities that they need so the programs can work well there. On Secretary Perdue's first full day in the office, he visited a school in Virginia and he announced new flexibilities for schools related to the meal standards. And last month, we announced new flexibilities for school nutrition hiring. These proposed changes are expected to expand the pool of candidates qualified to serve as leaders in school nutrition programs while continuing to ensure that school nutrition professionals are able to perform their duties and meet the needs of the children participating in the program. We've also asked our SNAP state agencies to let us know what flexibilities would help them run programs with more integrity, better serve customers, and would support the goal of self-sufficiency. We recently issued an advance notice of proposed rulemaking to request input on innovative ideas to promote work and self-sufficiency among able-bodied adults participating in the SNAP program. Our timing is off a little bit because the comment period actually ends today, but it does end later today, so if you have a chance to take a look at it, there's still an opportunity to comment on that. We've also provided SNAP state agencies guidance on how they can use contracted staff in call centers in certain roles to provide better and more integrated customer service across programs, integrating with other federal and state programs that are being delivered through those call centers. Over the past year, USDA has held listening sessions with states and child and adult care feeding program operators, We've taken their feedback to better support providers through job training, both through USDA's Team Nutrition Initiative and a partnership with the Institute for Child Nutrition. The Institute has traveled across the country providing 95 in-person trainings to CACFP meal pattern trainings to nearly 4,000 providers. We've created CACFP meal pattern training tools to train providers, operators, and menu planners in meeting the new CACFP meal patterns that took effect in October of 2017. The new meal patterns increase the consumption of vegetables, fruits, and whole grains and allow more nutritious substitution and reduce the consumption of added sugars and saturated fats. In addition, the new CACFP regulations established early education age groups. These improvements are expected to enhance the quality of meals served to young children. The updated standards also take cost and practicality into consideration. As an added benefit, these meals and snacks are often reflect regional and local food preferences. Procuring seasonal local foods is allowing sponsors and providers to more options to follow new meal pattern standards. We can also improve customer service by using technology and innovation. The expectations of today's digital world to conduct business anywhere, to have information available on demand, to get prompt and on-point responses to requests apply in the public sector as well as to the private sector. And we will benchmark to the best and use 21st century tools and strategies to advance our mission. A good example of this is our Capacity Builder map. Some of you may be familiar with this if you work with the Summer Meals program. The map allows users to visualize layers of information such as underserved areas and identify locations for needed summer meal sites. Users can find the nearest potential community partners such as multifamily housing centers, libraries, faith-based institutions, hospitals, military bases, schools, and more. The Capacity Builder is a powerful tool for state agencies and sponsors to evaluate the previous summer's performance, as well as planning for summer in a way that meets their unique needs. Another example of how technology is helping customer service is our first Food Buying Guide mobile application. We sought feedback from our stakeholders who asked us for a more streamlined way to access the information that they need to plan meals and purchase foods for child nutrition programs. The new mobile app fills this need by making it easy for program operators, manufacturers, and other stakeholders to access the same information that's found in our interactive food buying guide available online through mobile devices, wherever and whenever it's convenient for them. Child nutrition program operators can also use the food buying mobile app on the go to make quick purchasing decisions from their mobile devices. The new app includes a food yield search, comparison, and navigation features for more than 2,100 foods typically served in child nutrition settings and can help users create favorite food lists. The app also provides program-specific information for meeting each meal pattern component, as well as additional menu planning resources. Now, all of this can result in cost savings and increased program efficiency in child nutrition programs by helping operators know exactly how much food they need to buy, whether they're serving 30 kids or 30,000. It can also help improve program integrity by making it easier for program operators to adhere to federal nutrition guidelines. So the third focus area is self-sufficiency. And as I mentioned, all of our programs, we are striving to improve the long-term well-being of those that we serve. Now, when you hear the word self-sufficiency, you may immediately think, and the obvious connection to our programs may be the staff employment and training program, where we're actually providing educational and training opportunities. But when we talk about self-sufficiency, we're really thinking about it very broadly. And we see all of our programs supporting this idea of supporting self-sufficiency. For example, a healthy pregnancy and a healthy start in life supports a successful future, and the early years are critical. Our WIC program serves more than 7 million pregnant postpartum infants and children through their 5th birthday. And extensive research has shown that WIC is a very cost-effective investment that improves the nutrition and health of low-income families, leading to healthier infants, more nutritious diets, and better health care for children, and subsequently to higher academic achievement for students. Our Farm to School program that I mentioned earlier helps create healthy habits, take root early. I know that there are a number of Farm to School folks that are here in the room. Can you just give me a hand where the Farm to School folks are? Great, so we've got a great turnout with Farm to School. Thank you. So Farm to School is critically important because early childhood is an ideal time to establish healthy eating habits. Farm to Preschool works to connect early child care and education settings to local food producers and the objectives of serving locally grown fresh foods to young children, providing related nutrition education and improving child nutrition. Schools and school districts that offer Farm to School activities notice greater acceptance of healthier options and acceptance of school meals in general. Farm to School has helped schools transition to the meal pattern changes and continue to offer healthier options. USDA is also committed to ensuring that WIC and SNAP participants can make healthier food choices by ensuring that retailers have a wide variety of nutritious foods available for purchase. We've seen increased purchases at farmers markets by both WIC and SNAP participants. It's a win-win. It provides additional customers for farmers to support local economies, and it improves access to healthy, fresh food for SNAP and WIC participants. You might be familiar with the Bondi Food Center in Milwaukee. They actually just celebrated their 100th year, their 100th anniversary. They're connecting the greater Milwaukee area to local fresh food from farm to market to table. It's a SNAP authorized market and it operates throughout the year with the facilities that they have there. And they've been very successful in leveraging SNAP with a matching incentive program as well, so people can multiply their purchases using the SNAP incentives. And they're also very willing to share their successes. They're providing technical assistance and training as a partner in the multi-sector Milwaukee Farmers Market connection. Together, they're working to increase access to farmers market. In fact, since 2015, redemptions at farmers markets have increased 25%. So finally, getting back to the SNAP employment and training, we are committed to ensuring participants in SNAP have the skills and support that they need to work towards economic self-sufficiency. Self-sufficiency is a cornerstone of the American dream, and it does begin with employment. Effective SNAP employment and training programs don't just help people find a job. They help equip them with the skills needed to gain and retain jobs with the potential for wage growth. With 2/3 of jobs created over the next decade expected to require at least some education beyond high school, it's critical for SNAP participants who have limited proficiency or earn low wages to have a pathway to becoming self-sufficient. The department's policy goal is to move individuals and families from SNAP to work as the best long-term solution to ending poverty. For those able to work, SNAP emphasizes the importance of seeking a job and accepting one if offered, and many participants are already doing so. We must reduce barriers to work and hold both individuals and states accountable for participants getting and keeping jobs. It is important to recognize that there are some people who are not expected to work, namely children, seniors, the disabled, and others may be unable to work for other reasons. And SNAP is certainly there for them in their time of need. Even though the economy is improving in most areas of the country, the job market is still very challenging for people with limited education and basic job skills. SNAP E&T funding to states provides a package of employment and training services to SNAP participants. Services are offered by states or state partners like colleges and universities, American Job Centers, not-for-profits, and other social service organizations. These programs offer more than just help with a resume. They help participants obtain technical skills and make connections with employers that are hiring in their communities right now. I want to provide, in closing, before we get to the questions, an example of how one of our SNAP employment and training programs has a direct connection to the healthcare sector. And the healthcare sector is working in consultation with a SNAP E&T program. So this example comes out of Minnesota. And Ada, as a busy mother of three, seized an opportunity to find work in the healthcare field, which was a long-term goal of hers. She reached out to an organization called Hired, a Minneapolis-based SNAP E&T partner, and after seeing a brochure at her daughter's school. The hired staff provided her support and guidance and encouraged her to enroll in the training program at Hennepin Technical College. Ada quickly moved through the 2-month certified nursing assistant program. In December 2016, she started working in the memory care unit of a senior living facility in Minneapolis. So there's lots of opportunities for connecting with our programs and with our employment and training programs as well. And again, as I mentioned, we're committed to improving the long-term well-being of the people that we serve, both through the direct delivery of our programs and partnerships with all of you, and we'll continue to strive to do that with integrity, customer service, and self-sufficiency. So I know I've thrown a lot at you in a few different areas, but I did want to have time for questions. I think we still have time for that. And I know that many of you, I think probably all of you, are connected in some way or another to USDA Nutrition Assistance Programs. So I'm going to start with asking a question for you. And of course, you can ask them of me as well. But the question I have for you is, what are the ways that you think that your organization can help us in delivering our programs with more integrity, better customer service, and helping participants get to self-sufficiency? What are things you can do? What are things that USDA can do? What are things that we can do together to that end? So I'm open to all of your questions, but if you want to react to that question as well, I would appreciate that.
Okay, we'll open it up to any questions or comments. I'll pass around the mic. Warner?
I'm part of the Rural Food Pantry Network. We also are involved in I'm over here, I'm sorry, do you want me to stand? I'm sorry. A Getting to Work initiative and whether transportation's an issue. However, when we get to self-sufficiency, how do we address the fact that there are paying jobs that are lower paying jobs, and people are working and doing the best they can, and they would be classified as quote unquote the working poor, and there's 2 incomes, but they're self-sufficient to a certain extent. And how do we look at that in terms of self-sufficiency and trying to move people from SNAP to off SNAP and working when they are working, and they will continue to work in a field for which they're comfortable or they're skilled enough, and maybe the wage bases aren't there? And how do we address that?
Thank you for that question. So certainly SNAP is designed in a way that does provide benefits for people who are working, looking at the income limits, and the program works that way. And there isn't a drop-off where you get a job and then you lose your SNAP benefits. There's that recognition that there is this gradual climb that you need to make towards self-sufficiency. So the program's going to be there for those folks that are eligible. Our focus is really working with them, working with employers that can provide those opportunities for wage growth, for the technical skills that would make them eligible for those jobs, that would help lead them to higher wages and ultimately not need SNAP and become independent. But certainly it's in combination with the SNAP program that the benefits are there to support people. We've got over 40% of the folks that are on SNAP right now are working. So your point is a very good one. There are people who are working that are still eligible for SNAP, and the program's there for them.
I had a question about the integrity section of your talk, and what percentage of the budget that we're speaking about do you feel is lost to fraud, waste, and abuse? And what is the expected return on the focus that you mentioned, including the creation of that chief integrity officer and the expenditures that go along with that? How do those balance out?
So I actually don't have specific numbers on that loss. When we talk about fraud, waste, and abuse and program integrity, we think about in the sense that we want to make sure that people that are eligible for the program are in fact participating. So you've got that kind of front-end certification, whether it's the school meals program or SNAP, making sure that people are meeting the eligibility requirements and are able to participate if they're eligible. And then there's the use of the benefits, the more along the lines with our SNAP program and our WIC program, so that people who are receiving benefits are using them appropriately in SNAP authorized stores and WIC authorized vendors, and that the vendors that are participating, SNAP retailers that are participating in our programs, are utilizing those benefits appropriately. We do have a number of studies that are out there on different programs. I know in our SNAP program, the incidence of fraud is less than 1.5%, where benefits are actually misused in a store, so we have numbers on that. We have numbers on the certification for kids participating in the school meals program. That's a little bit higher, and one of the reasons I mentioned in a couple places, we are really focusing on that, trying to help bring that error rate down in the application process for school meals. So there is work to be done, and as I said, it's really always been an area of focus for USDA. Our programs rely upon congressional support, taxpayer support, and people want to know that the benefits are getting to the people who are eligible and they're being used appropriately.
Do you feel like there's any danger in making that, I'm not sure if it's always prioritized this way in discussion, but the first pillar of this discussion, and feeding the misperception that these programs are less effective and more fraught with abuse than not?
The order that I had was kind of how we talk about them, but they're not, we don't see them in 1, 2, and 3, we really don't. That is, always a concern, that you want to make sure that you're painting a complete picture of the programs, the benefits that they achieve, how they operate, program rules, so that there's a full understanding that there really isn't a huge problem with this. But when you have programs serving the number of people that they are, the dollar values, when you think about SNAP being a $70 billion program, even the smallest amount of waste or abuse in that program adds up to large dollar amounts, and that are concerning to both Congress and the American taxpayers. So we owe it to, as stewards of those funds, to make sure we're focusing on integrity.
Hello, I'm Yvonne Greer from YE Wright in Milwaukee. I wanted to know, they're proposing food boxes that would be given to recipients. How are you going to assure the quality of the food that is given out? There's some, thought that it's going to be a lot of processed food, commodity foods. How are you going to assure the quality that you're giving the people when we really are looking at having people participate in work and self-sufficiency? They need healthy food.
So thank you for the question. I may not have a satisfactory answer for you. So I need to start by saying, so as a career federal employee, I really can't speak to proposed policy. I can talk about kind of what's out there and the process, but not comment about the proposals themselves. So the proposal that you're talking about, the America's Harvest Box, is part of the President's budget proposal for fiscal year 19. And the way that the process works is that needs to go to Congress for them to take that under consideration for inclusion in a farm bill or an appropriation bill. So that's kind of the process that it follows. And I know that there's a workshop later on about the farm bill where that may come up, but I'm really unable to talk about any policy proposals that are out there right now.
Hi, I'm just curious what your organization is doing to make applications and online processes more accessible to folks who may not be able to get into a food share office from 9 to 5, or may struggle with the paper applications or even the online applications, which are still pretty complicated.
Right, so USDA actually has invested resources and work in this area. We've had a contractor that's worked with states to try and make their applications more accessible, more streamlined, to make it easier for people to get through that process. And we provide ongoing technical assistance and best practice sharing across states, and where we have good examples of applications, both paper and online, to help people through the process to, again, provide better customer service. So that is an area of focus for us. It's something that's been out there for a long time. Some states have made good strides in that area. We want to make sure that we're sharing those with other states.
I would also plug a session, the first session this afternoon, we have our state DHS office with the SNAP team. They might have more on the Wisconsin application.
Quick question. I was curious if there is any discussion on making restrictions on healthful choices in SNAP benefits. So when you're in a grocery store, limiting those purchases to healthful options.
So that's been another big issue around the country, and we've seen a number of states that have submitted proposals. At this point, we haven't approved any of those, but it really does come down to how do they work, how do they affect customer service, how does it work for the participants in our program. So I can't say we wouldn't necessarily look at that, but we haven't approved anything along those lines yet, either in past administrations or the current administration.
All right, I know you said no policy questions, so I'll try and make it not as policy, but recently the Center for Medicaid and Medicare Services came out and said they'd start covering things like groceries, air conditioning for Medicare Advantage plan members, and so I'm curious, one, what your thoughts are as far as working, from your current funding sources and how you start to think about different funding resources like that, and two, how we think about, all the folks in the room and other organizations working as part of that new coverage option.
Thank you. So I'll answer that in maybe a little bit of a broader way. Hopefully it still kind of gets at what you're looking for. So one of the long-standing challenges that we have across really all the federal programs is how do we make them work better to serve the people that need those programs, and how do they work better together for the administrators of these programs, because the rules aren't always in alignment, the funding streams aren't always in alignment. So there is a renewed focus on that in trying to find ways that we can work better across federal programs to align policies where we can, to funding streams where we can, to provide the kinds of support that you want. It's a tough nut to crack, I will say, but it is something that we're looking at again, having conversations with our federal partners to try and come up with ways to do that. And a specific example of that, not necessarily with the healthcare sector, but with our employment and training program. We're one of the federal agencies that have federal workforce programs. We're not certainly the largest. Department of Labor, Health and Human Services, Administration for Children and Families has a big workforce component, and our programs don't always line up, and the funding streams don't always line up. So we're trying to look at how can you bring all of the programs, the supports that are there together to better serve the specific needs of the person. So maybe we can do, or labor can do something with a subsidized employment, but we can do something in SNAP around helping with transportation subsidies or childcare subsidies. So looking at the whole person, looking at their needs, and trying to come up with ways to, if we can't make the programs all come into alignment, how do we best make the programs work together to serve the customer?
Great. Hey, Tim. Thank you. My name is Robert Campbell. I'm the Policy Director at Feeding America, the national office in Washington, D.C. So I appreciate Tim's constraints on what he is able to comment on related to policy. I do not have those constraints. So I'm happy to chat about any and all of them. Plug for the Farm Bill session tomorrow I'll be speaking at. But the second very tangible thing, Tim mentioned that there's a comment period right today, that ends today, where USDA is seeking input on some potential changes to the rules around requirements for what we know as able-bodied adults without dependents, right? So either unemployed or underemployed adults who are trying to find more hours or better pay or a job, potential changes to the restrictions that are currently there. It is not too late. Those of you who are on social media, on Twitter, if you go to the hashtag Hunger and Health, I just retweeted a link to a form that you can fill out still before the deadline. It's actually midnight tonight. We'd appreciate if you get in it earlier because we're trying to work with USDA to facilitate all these comments. thousands upon thousands of your colleagues across the country have submitted comments to USDA to let them know we want to make sure the program stays strong. So if you haven't done that yet, there is still time. A quick 5 minutes should be all it takes. So as you're wandering around and have some time today, feel free to do that. And I'm happy to answer any of the other policy questions as I'm here, and happy to talk with others. Thanks.
Thank you.
We have time for a couple more questions.
Thank you to the person that just spoke. My name is Bridget Wilder, student of Mount Mary and owner of Perseverance Health and Wellness Coaching. My question is, as we address healthy food, I also want to make sure that we're addressing the dignity and the respect of people in poverty for having freedom of choice with food selections. One of my concerns is maybe their children may have a birthday party, they can't afford to buy a birthday cake, and a lot of these policies want to restrict them to certain food options. So just maintaining the respect and dignity of those who are impoverished is important, and I just want to relay that message as well.
Thank you.
I just wanted to kind of piggyback off that last comment. There's a really famous book, The Road to Wigan Pier, written in the 30s. It was about the same topic of how people could live healthily, how little money. And it took place in Great Britain and was trying to prescribe what poor people ate and at the lowest possible dollar. And I'm a firm believer that if people get the right information, they're going to make the right choices. And that's not something we have to impose on people who already have very little choice in their life. Just wanted to piggyback off that last comment.
Thank you, and I'll mention again that a number of our programs have this nutrition education component, part of it. Certainly, I mentioned Farm to School, how that's so important for young children being acquainted with healthy food options. But our WIC program has a nutrition counseling requirement that's built into it. SNAP has nutrition education. It's all about educating people to make healthy choices for themselves, the choices that make sense for themselves and their family. So, thank you.
Any last question?
So, real quickly, what is the USDA doing to address the very false and negative stereotypes that are out there about folks who are on SNAP, that kind of thing? Because it's those false narratives that lead to elected officials to always want to put SNAP the first thing to be cut. So what is the USDA doing to try to change that narrative in the public? So it's not always the first one to be cut.
So it's about really sticking with the facts, right? What did the data show? Who's participating in the program? Who's benefiting from the program? How benefits are being used? So it's really putting the facts out there, and the facts show the people that are benefiting, the most benefits are being used appropriately. So that's really where our focus has been, just being able to tell the story of the program and how it's working and it's how it's helping people, and certainly being able to add the SNAP employment and training, it's how it's also helping people get the self-sufficiency as part of that story as well, why the program is so important. Well, thank you again.
Thank you, Tim. And thank you, Dan and Ellen, as well. My name is Stephanie Dorfman. I'm the SNAP Outreach Manager at Feeding Wisconsin. I just have a few housekeeping things for you, and then I'll let you be on your way to the networking break. Thank you again to all of you for taking the time out of your work and your lives to be here with us. The Feeding Wisconsin team, including David, are grateful to bring together such an amazing network of organizations and individuals to fight hunger, improve health, and strengthen our communities. So a few housekeeping notes. Along with your printed programs in your totes, we welcome you to access our conference app site. I think it's called Sketch. A link was sent by email. You can also find it at feedingwisconsin.sketch, that's SCHED.com. And you can find the mobile app at feedingwisconsin.sketch.com/mobile. Sessions will be held in rooms E, F, G, H, and I. Those will be through the lobby and then on your left. We will have planning committee members there to direct you. Restrooms are either to your right as you exit or down the hall. We have one small change in our program for this afternoon. The 4:15 WLFN track session has a small change. Teacher Olson was sick today, so we have Sarah Lloyd, who will now be facilitating a discussion on DACPAP and USDA resources. Following the second session of the day, please join us for a reception in the Upper Dells room. That is one floor above us, so there are elevators that you can use and stairs to get to that room. That will be from 5:30 to 7:30. Next up is a networking break in the lobby, so as you exit the doors, there will be beverages and snacks. Help yourself and take some time to check out the exhibitor tables and network before sessions begin at 2:30. So thank you all again, and help yourself to some beverages.